That absolutely technology can play a role in reducing that burden and helping the workforce to focus on the thing that they can do that no amount of technology can duplicate, and that's caring.
I'm Dr. Louise Messara. Welcome to Season 4 of the Future Health podcast, Future Proof, a podcast about the future ways we will work, the work we will do, and the impact of technology and scientific innovation on the future of the healthcare industry. We have a fantastic lineup of guests this season as we cover topics ranging from life-saving cars to robot lawyers and even diagnostic t-shirts. So go ahead and like, share, or subscribe now so you don't miss a thing. Only a few years ago, grandparents were calling their children and their children's children to help set record on my VCR. Today, those entering their senior years are the first generation who have engaged with technology in almost every aspect of their daily lives, from banking and ordering groceries to playing Wordle with friends across the globe, and even providing remote early morning babysitting via FaceTime. Grandparents are no longer technophobes. They are the first tech-savvy generation of elders. Today, we're going to hear about the new technology-rich experimentation spaces that are prototyping, trialling, and exploring how to make a real impact in aged care settings for this generation of tech-confident users. We will explore some of the opportunities that exist for a different sort of aged care and the role technology can play in meeting the recommendations of the recent Royal Commission into Aged Care to ensure the aged care system of the future meets society's goals of dignity and respect. I'm Dr. Louise Messara, and this is Future Proof. Vishal Kishore is Professor of Innovation and Public Policy at RMIT University and holds a number of board and advisory positions across the Australian and regional innovation and impact ecosystem. He has previously been Deputy Secretary at the Department of Health and Human Services in Victoria, Director for Government Strategy in EY's Management Consulting Practice, a Mergers and Acquisitions lawyer, and an Associate at the Federal Court of Australia. Vishal has held academic and research fellowships at Harvard and Brown Universities in the United States and the University of Melbourne and Monash Universities in Australia. Nithya Solomon is the Director of the Health Transformation Lab at RMIT. She is an innovation executive, strategist and versatile business leader, renowned for her creativity in shaping unique ventures in philanthropy, social innovation and public health. She has held senior leadership roles at Nike, Ernst & Young, Vic Health and Accenture, and has wide experience and expertise in private and public sectors in Australia, USA and Latin America. We're very honoured to have you both with us here today. Your recent report was written in response to the findings of the Royal Commission and really argues that technology is going to be a bridge to treating the elderly with respect. Can you talk a little bit about the relationship as you see it between technology and an improved aged care system?
Now, of the huge number of recommendations, I think there are about 100 pages of recommendations. There was a very small number of them that were targeted towards technology. And so you look at those recommendations and they're like, oh, we should use technology for the purposes of making the system better, and absolutely we should. But what that caused was a whole bunch of technologists running towards the aged care system saying, I have this app or I have this system and you should use that and that's going to make a difference. But when Nithya and I and the team were thinking about this, we thought, is that all? Is there something more that technology can bring to the party? And so we started thinking about, well, can technology play a role in making respect a hallmark of our system? And so that's what our report is really trying to do, a very foundational difference. And one way to think about it is, what does respect even mean? So if I want to respect is a relational thing. I don't respect in the abstract. I have to respect a person or a thing or a group of people. So if I want to respect something, I need to be able to perceive it. I need to be able to see it. And I cannot perceive something that I'm not connected to. So if it's isolated or if it's disconnected from me, I can't see it. Therefore, I can't respect it. No connection, no respect. Technology is really very, very good at fostering better connection. And so if connection and respect are related to each other, then technology has a really big role to play in creating more respect in the system. Because technology shrinks space, it hyper-connects people, it can allow us to see things about people that we might not notice immediately.
So would connection be the biggest impact that technology can bring to the aged care space?
Yeah, I think that's the foundation. Technology can bring this foundation of connection through the system. And then with that connection, armed with that connection, we can do many things that we can't do right now.
Yeah, so technology, it's innovation, technology, transformational change. It's been widespread across most industries. And it was really interesting for me as I was reading through both your report and the Royal Commission. There's an obvious sort of feeling of the aged care being left behind. Why do you think that's the case for aged care?
I think there are a few reasons. On one level, technology investment takes time and it takes money. And if you look at the dynamics of the aged care system, it's an unbelievably disaggregated system. So a few numbers for you. So if you take the whole aged care system, about 25% of the aged care system is dominated by 10 players. The remaining 75% is made up of more than 1,700 players. So these are often very smaller players. They don't have huge overheads to invest a huge amount of money into technology. They don't have the time to be able to pull themselves away from practice. Why? Because they're engaged in the caring process. So that fragmentation and disaggregation of the system makes it hard to invest time, money, and effort in new technologies. But it's also the case that there are other reasons. We are dealing, the pandemic showed us some of the dynamics of the workforce in aged care. This is often a very overworked group of human beings working at multiple sites within a single day. It's a complicated space. And so training the workforce is not an easy thing to do in new technologies and new approaches, and takes time and takes conscious effort and takes good strategy and policy. And then I think probably the last thing is there's this weird idea. I mean, not weird, but there's this idea that we have that older people don't use technology. And actually that's just simply not the case.
Well, I mean, the older people that don't use technology we're probably a different generation of older people now. So,
exactly.
I mean, I think one of the reports I was reading was talking about 60% of people of all ages, or certainly the older generation, are using the internet every day.
Yeah.
And yet, so many of the facilities that they're moving into don't even have Wi-Fi as a standard offering. But for me, that's sort of exciting because it seems to open up a breadth of possibilities of people that have some confidence in technology moving into the space. So that idea of acceptance maybe falls away a little bit, and there's less of a job to bring the user or the client along on the journey.
That's absolutely right. And that number that you talk, 60%, is correct. But it's really interesting for people who are aged 65 to 74, 74% of that group are daily users of the internet. So that group that's coming through, and you can imagine at the age band below that, so it would be close to 100%. So there is a kind of a fundamental skills and demographic change that's happening in our education system, which means acceptance, use of technology, and being able to play with those possibilities and leverage them for better experience and better outcomes. It's going through the roof. So it's exciting. So,
you and your team, you've created this health transformation lab. Maybe you could just explain to us a little bit about what these environments are like, and maybe some of the developments that you're working on. And, I don't know, some of the big picture ideas that you're thinking about to transform aged care. Nithya.
What it means is that we have organisations who come and work with us in very different ways, right through from coming to deliberately be provoked in new directions, to be part of a shared applied innovation journey, to collaborate with us on prototyping and developing solutions. And so one of the spaces that we have been really excited to create, we've called it the RMIT Cisco Sandbox. It's a digitally rich prototyping studio. It's a collaboration space. It is a place where we can have entrepreneurs and technologists, clinicians, community members, students all come together to be part of this shared collaboration. And to give you a sense of the space that we've got, so it's physically in at our offices. It occupies about the space of maybe a shipping container or a small bus. And if you look at it, it looks like it's health or hospital themed. So each of these spaces has been equipped with lots of technology that you don't obviously see but are there in the space. So there is the Cisco Collaboration Suite, which is very sophisticated and cyber resilient in terms of communication powers and more. We've also built a range of custom analytics. There are a number of sensors around the space as well to really create a health space that doesn't have to be purely in a health facility, but that has the ability to be smart in the way that we might have once thought about as science fiction, but is actually now quite the norm. In terms of robotics, 5G, AI, the Internet of Things, cybersecurity, that can all communicate together to create quite seamless experience.
And do you think that this sort of environment is going to play a role in speeding up the translation of research into practice by bringing, what did you call it, the anti-disciplinary group together? I like that. I mean, is that part of the aim of this sort of environment?
Absolutely. We believe it's fairly critical in this next phase because, the paradigm now for technology is less about here's an individual product that you implement somewhere that is going to solve a range of problems. Products or applications coming out have to consider that there is already an infrastructure to work within. There are numerous interfaces. There are users who are using similar types of technology for their social worlds, for their medical worlds, for their commercial worlds. There are all sorts of implications for workflow design. And so, and bringing these pieces together, it takes time to work out how to do all of that, but there are also many, many options and possibilities for how to do that in a way that can really serve us well. So we absolutely believe that spaces like this are essential to really, in a detailed sense, think through the end-to-end of how systems could start to look very different. It would be very difficult to walk into a hospital and find a space like this for doing pure prototyping. Yeah. We definitely couldn't walk into an aged care residential facility and find a space like that. And so it's really a time now when models like the sandbox and spaces like this can really come into their own so that we actually can invite clinicians and community members into the space to think about how could specific workflow look really differently and how do we do that in ways that don't disrupt any existing ongoing processes.
I mean, you mentioned some clinicians and end users and
yes.
I think we've talked about entrepreneurs,
yes.
And I'm interested, is there a role or do you, in terms of sort of policy makers, because, a lot of people will be sitting in this building with their own visions for how we're going to transform elements of healthcare, maybe discrete from some of the work that's going on in the sandpit. I'm just interested as to how that relationship functions or how you see it could improve.
Yeah, lovely. A huge motivator for why we created the lab was if we were in the United States or if we were in England and you said, let's go and find the best practice or who's doing the cutting edge thinking in respect of health innovation, I would know where to take us. But when I was a policymaker, I didn't know where to go in Australia. It wasn't completely clear to me where to go. And so we decided, well, why don't we create such a place? And so very much the idea was it should be a place, it can be a place, it must be a place where policymakers can come in, watch, look, experiment, try, provoke, suggest. And we've had a lot of great experience doing that over the last few years as well. So we've had policymakers in, we've had not just kind of classic policymakers, but regulatory players as well. So when we were starting to do work in respect of aged care, we had people who are more conversant with the regulations around aged care saying, well, could we do this? Would that be possible? And they're like, yes, no, actually, definitely don't do that, but you could do this. So it's it really has that bubbling sense of experimentation. It's great.
We've been talking a lot throughout this season around sort of emerging technologies and the acceptance of those technologies by the people the technologies are being developed for, but sometimes at arm's distance or arm's length from the end user. I mean, you've mentioned that they're involved in your space. I'm just interested in how involved are the aged care residents, the carers of those people, the families, because there are so many different performers in this space. Yeah. How involved do they get to be?
Extremely. So another project that we're working on, we're doing in alliance with good friends of ours in the aged care space. We're developing some technologies that can be used by older Australians. They're very involved in that. First, they gave us initial advice on what would they use it, how would they use it, et cetera, and now they're walking around strapped on with prototypes on them and really genuinely working with it. So that has been, I think, one of the most rewarding and interesting things, because it turns out to, as we were talking about before, you can have a lot of ideas about what a particular patient group or a particular service user group will want or not want. Nothing beats actually asking them. So,
always. So how far are we really away from this idea of a sort of smart space in aged care? What is the time frame until this becomes an environment that my parents are going to experience, or is it my children's parents? Is it me?
Yeah.
Is it me?
That's
yeah.
You, yeah.
Sure. Well, I mean, on the bright side, we actually have a lot of the technology already. So in some ways, the market perhaps, it's in the hands of the market as to how fast the reality can be implemented. For example, some of the types of scenarios that we were able to demonstrate in our prototyping space included ways that the space could know that falls happened in areas where they weren't expected, like in corridors or social areas. There are ways of using emotion detection, for example, to capture in common spaces where there might be aggressive outbursts or situations where behavioural issues might want to trigger individual intervention. There are technologies that monitor surfaces to inform you of when meal trays have been perhaps left untouched for 10 minutes, and so alarms could be signalled in fairly real time so that resources can be directed towards these issues. So and that's just a handful of examples, but there are many more, and so the technology exists for sure.
So the technology there are opportunities to be enhancing the quality of the care. I suppose it also leaves open the opportunity to be monitoring the quality of care, albeit with the usual questions of privacy and those sorts of issues. We read in the Royal Commission, as you described, some intolerable levels of care, and these are some of our most vulnerable citizens. So how do we monitor in a safe, discreet, sensitive, respectful way?
We do have tools to work out how to most respectfully use the technology in a way that affords the level of privacy and visibility that the particular situation requires. So thinking through when you might want to trigger image feeds to activate so that only certain interactions are captured, where you might want to store data and who can access it, whether there might be portions of a space that are monitored. There's perhaps one of the first places that many will go to with monitoring is cameras and video feeds, but there are other ways to monitor as well in terms of surface conditions and devices that can know when a carer and a care recipient are in a space together so that it can start to count how many minutes of caregiving time are there automatically, for example. So there are really many ways that the design of technologies in application can really provide the ability to customize when certain levels of monitoring or information capture are required, and at what times a situation requires for that to happen.
I mean, that's a very high level of sophistication in terms of the application. If we take it sort of a step down and think about just the opportunities offered by automation, I mean, this has been an industry that has been quite resolutely slow to implement some of the normal digitisation of work process that we've seen in many other industries. But it would seem like there's a big upswing opportunity for workers in aged care to benefit from the automation of some of their repetitive or administrative tasks. And we've just all watched a portion of our society really struggle during COVID. We've seen the shortage of workforce in the aged care arena be highlighted. So what role do you see technology playing in sort of improving the experience of the workforce, I suppose? And is it a way, we talk about respect for our elders, but is there also an opportunity for technology to sort of re-inject that meaning and bring respect back to the role of carers?
100%. And I think the language that's often used in health, as you well know, is the idea of helping clinicians or carers to move to the top of their license.
Yeah.
So
top of the scope of practice, isn't it?
Yes.
Yeah, that's what they like.
And we definitely see possibilities, and Nithya spoke about some of them, where right now there's a clipboard where a carer might indicate how long they were, providing care to a particular person, etc. And particularly with some of the new regulations that will be coming out, you'll need to document these sorts of things. That's going to take time, and that's not the main reason why most aged care workers got into the game of aged care. They're in the game of aged care to care. And so if we can take away some of those manual administrative tasks. In the report, we call it breaking the tyranny of administrivia. So if we think, if we can, that absolutely technology can play a role in reducing that burden and helping the workforce to focus on the thing that they can do that no amount of technology can duplicate, and that's caring, human-to-human caring. And so one of the reasons why we think this kind of technology reaching this sort of sophistication right now and the focus that we have on it is that we think it is one of those interventions that can absolutely help the workforce to capture, recapture, hold on to, augment and amplify the raison d'etre that got them there in the first place, the reason that they're there, caring for others.
Nithya, do you think this is going to change what the role of the worker in aged care looks like in the future? Are we going to be looking for, are they going to need different skills? Are we looking at a different sort of aged care worker?
Isn't that the question that many organisations are asking, for sure? And it's so interesting because particularly in the way that we have outlined the opportunity for that real technology transformation, in some ways it's a fraction too early to tell until we get a sense of how, in specific contexts, the technology infrastructure may be set up. With smart spaces and articulate spaces, the infrastructure of the space itself can be designed in a way to take up some of the burden of how the technology is used. So we think of it as digital infrastructure that's akin to the, furniture and pieces in the room, but not elements that need to always be activated and switched on and used and deployed by a care workforce. So that's kind of one dimension to acknowledge. The other is that increasingly a lot of the technology solutions are leveraging interfaces that we're quite familiar with in our day-to-day world in terms of smartphones and tablets. And so the adoption of some of the interfaces is being thought of in ways that are already in the realm of the familiar. So with that in mind, we're really excited about the opportunities of this kind of technology enablement. Is what then does it mean for workflow, and how can you design day-to-day interactions really differently in many ways, disrupting the notion that the carers in the setting have to do all of these things. Yeah. The space takes on a lot of that burden, and so how could resources be deployed or channeled differently with the kinds of inputs that you might receive from technology, for example. So we're quite excited about the workflow angle.
And do you think that will then, I imagine it's going to play a role in trying to address the shortfall that's projected in sort of workforce and staff? That's the dream, I suppose.
It surely will be part of the story, but I think we do have profound problems in the aged care workforce. The projections are not good. I think by 2030 we're going to be 100,000 workers down or something. So I think addressing the workforce challenge as policymakers who are focused on this know very well is we're going to have to do multiple things at the same time. But definitely we think this has an important role to play.
Yeah, I suppose that bringing the meaning back is very incentivising as well to
Absolutely.
Just recapture the imagination of people thinking about going into aged care. If we just shift our focus a little bit back to that connection that you were talking about right at the start, certainly entering the aged care environment, it's very daunting for a lot of people, both the people entering and their families, concerns about care, how they will feel the disconnection, the isolation. I mean, this is all worst case scenario. There are some environments that are wonderful and supportive and fantastic, but absolutely. I think those fears are very real for a lot of people. And I think we all use technology so much to connect ourselves in our everyday life. The idea that isn't either the same or even enhanced in an aged care environment seems frightening. But it sounds like you guys are tackling that as well. Is that?
We're hot on that trail. So my beautiful 104-year-old grandmother just went into aged care, more formal aged care. And, I was watching the process, having done this work and thought with Nithya and the team about these various things. And for her, there's just life. So she doesn't want this to be a big disjuncture. She doesn't want this to be a big break. She wants to continue with her life. She wants to see her children and her grandchildren and her great-grandchildren. She wants to engage in the same sorts of things that she's engaging with now. So I think a really important part of what we can and should be thinking about for technology is to ease those transitions such that they don't actually feel like transitions anymore. Movement from increasing levels of support or care for people as they age should feel as much as possible behind the scenes and natural, just enabling them to continue to live as they choose. Which is why, as Nithya was saying, making the spaces smarter so that human beings have to do less work is actually really important. So putting the burden on the space so that all of a sudden you're not medicalized and people are counting minutes that they're with you, but there's something in the background is counting care minutes in a particular kind of a way. It just means that you're just living your life and the space is smartly looking at the things that we know it should, that the interfaces look like what you were working with before, that the connections between people are heightened, as you say, in the aged care space rather than there being a big drop-off as you moved into that space. And I think actually this is a moment where COVID has really helped us to understand. Everybody was locked down. The only way you could see grandma is on a tablet, and the only way you could see your grandchildren is exactly the same way. And so I think that kind of smoothing of the transitions so that there's just life and things happen in the background is something that technology can play an important role in. And that makes the human experience of moving between different care phases or care settings or stages of life, it makes it much more comfortable.
Well, that was exactly the next question was going to be around the fact that aged care happens in all sorts of environments, and often in people would love to age in place if they could, at home if they can, and it feels like with the support of technology, perhaps more of that will be enabled. What do you think are the specific emerging technologies that we can all hang our hat on to think we'll be able to stay in our homes for longer?
1.2 million Australians receive aged care services of one form or another, but I think only about 20 to 25% of those services are delivered in residential aged care. So the rest is delivered at home. As Nithya says, there are some interesting surface monitoring technologies. We're aware of other sensors in beds and so forth to detect falls. We've got cameras that can without recording necessarily kind of a constant feed of information, it can tell when a human being goes from this to this on something that's not a bed or a couch. But one of the perhaps most so there's all of those kinds of technologies. But there's a fantastic additional technology that we've designed in the lab, actually, which is really excellent. About 68% of older recipients of aged care suffer from either severe or moderate cognitive drop-off or impairment. So it's a real, you can't always rely upon the person to report when something's not right. Sure. So we've got a technology that our team has coded which can look at a face and monitor emotions based on facial expressions. It's getting increasingly smart and good, and it's freakish how it works. So you can smile and it codes you as happy. You can have a confused look on your face. It knows that. Angry, it can measure gesticulations and so on and so forth. So this is actually a really interesting technology. It's useful in aged care, surely, which will allow us to kind of know a little bit more about spikes and troughs in a person's emotional state, which is really important so that things aren't going bad in the isolation of somebody's home. But also it could be used in all kinds of different other settings, which friendship groups, marriages. So it could be used in a range of different ways. And it's really fascinating. We've also got other wearable technologies that can measure conversation levels that we're playing with. It doesn't capture conversations, but it looks to measure amounts of conversation, and we're trying to figure out if the amount of conversation that you have can be correlated to your felt experience of loneliness. So now we can keep people in their homes. If we can assess whether or not they're about to get lonely, well, that's helpful. If we can assess their emotional state, well, that's really useful. If we can see when there's been a fall or they're not eating properly, that's really helpful. And if there are sensors that show when they're using the kettle or not, we can start to get a real picture, completely private and anonymized, and it would be very easy to spring alerts to let us know we should go visit this person, we should spend some time, etc.
Now, this is it's a broad question. We can talk about it as a group. The pandemic really sort of showed a lot of us, I suppose, the art of the possible, particularly with respect to technology. And I don't know, a lot of the rules just seem to disappear in the face of necessity. And there seemed to be a different appetite from government and even large institutions looking for new practical solutions. And I'm just wondering, you run an accelerator. Was COVID the ultimate accelerator for the work that you two are doing and your team is doing? And has it sort of changed the way you've prioritised what you're focusing on, in the next few years?
So I think COVID was a partial accelerator, not a general accelerator. So it's surely the case that when the pandemic hit, our lab took a wartime footing immediately. And so we started to work on projects that we knew were going to have so some people were working on vaccines and some people were working on containment and, PPE and so on and so forth. And we said, well, we're going to do everything else. So, how can we repurpose different spaces for different health uses? How can we convert parking lots into COVID testing facilities? What are the interesting ideas about dropping in surge capacity into particular areas? So we definitely moved to that wartime footing, for want of a better term. But there's a whole bunch of innovation deep technology innovation that we work on, that we rely on, that we want to figure out ways to use, that was really slowed down by the pandemic. So people couldn't get into their labs. So they can't develop the technologies that were really important. Biomaterials that were needed to create new kinds of face masks, we couldn't get them into the country. And so supply chain was disrupted in all kinds of ways. Locations were disrupted in all kinds of ways. And so there was a real chilling effect on different parts of the innovation system. But I think overall, as you rightly say, the pandemic also did create this sense of, hey, there's a whole bunch of regulations or a whole bunch of things that we think are stopping us that with the stroke of a pen we could kind of free ourselves from. And I think what we got in its place, I think there are two mistakes we could make. We could make the mistake of saying the kind of cobbled together different environment that we put together is the new normal. It's not. It was a workaround. It was something that we used in the midst of a crisis. But it would also be a mistake to say, let's go back to the way things were, which were obviously not. So actually trying to figure out ways to leverage that sense of, can we just can we go around this rule? Is this rule really necessary in order to create something that's more resilient? I think is the challenge that we're all now kind of grappling with.
It's interesting because there were definitely concepts that got very accelerated in terms of acceptance during the pandemics, in terms of telehealth as a model or dynamic spaces, and we saw amazing examples of health spaces outside of hospital walls and in shipping containers and car parks, and all of those amazing models come to life, which was definitely helpful to have as an accelerator in terms of what kinds of infrastructure should we be looking at building for the future. The parts of our work that actually got slowed down were the people-facing portions, as Vishal was saying. So we do want to work a lot in situ and work with ultimate end-user groups. The ability to access people in the in-person, face-to-face experiences definitely had to get put on hold. But at the same time, parallel or subsequent to the pandemic or adjacent to the pandemic were a range of other advances in the technology space that have served to certainly accelerate ongoing adoption of technologies. And we have a lot of work that we're doing now with robotic helpers in the lab. That how could robots and automation be used respectfully, intelligently within health spaces? What we can do now that the pandemic era has passed is actually take the robots to public spaces and do the ethnographies on how do day-to-day people and the general community actually feel about encountering a robot in a public space. We can work with our nursing simulation lab now that the students are back on campus and try to understand how would nursing students feel about having robots accompany them on their rounds. So, thankfully, we can accelerate those types of interactions again, which is just so critical for applied innovation.
For decades, we have been saying that the future of health is hospitals spin back to hardcore acuity. We do more in situ, we do more in the community, more care in the home, hospital in the home, HIF models, etc., etc. I think that for the first time, it's not the case that these technologies weren't there before the pandemic, but we've all now seen them and played with them a little bit more in and through the pandemic. And so this kind of idea of dynamic spaces, smart healthcare, articulate spaces, and the need to do innovation at the edges of the system through spaces like the sandbox and similar, this is on like drugs at the moment. This is on adrenaline at the moment. This has really been on steroids, in fact, is the drug that I'm thinking of. This has all been put on steroids. So I think we now have the ability, we can now see that we have the technologies to bring to life a model of healthcare that we've all been talking about for quite a long time. So I think that's quite exciting. There's a new push across industry as well. And when I say industry, I mean the health sector, but I also mean technology companies like Cisco, groups like Samsung, groups like Apple, doing more and more in this space. So we always know that after a pandemic, a friend of mine, Buzz Palmer, is keen to, often says this, we always know that after pandemics, we have a huge uplift in health and in economic development. And so actually, if we rein the horses right now in the right way, we could have a kind of a golden age of health innovation. So that's what we should be aiming for.
Well, I think that's a perfect spot to finish our conversation. Vishal, Nithya, thank you so much for being with us today. It was a pleasure.
Thank you very much.
You.
Beautiful conversation.
Go ahead and like, share, or subscribe now so you don't miss a thing.